My name is Vincent Picozzi. I'm a medical oncologist in the Division of Hematology Oncology at Virginia Mason. And the way I put it is that I didn't really choose pancreatic cancer, it chose me. And as I've been involved in it now for the last 20 years, I've come to appreciate that involvement. Well, pancreatic cancer is a cancer that arises in the pancreas. There are two forms of it. One, which we call adenocarcinoma, and that's the way we commonly think of pancreas cancer, like Patrick Swayze had or Michael Landon. And then there's another form of pancreatic cancer, which is known as neuroendocrine cancer. So these two different forms of pancreas cancer, which have very different biologies, very different outcomes. But most people have the first type, what we call adenocarcinoma of the pancreas, or cancer of the exocrine pancreas. In order to try to advance care, we try to utilize talents in every area of medicine. And so, for example, if we take surgery, we are constantly looking to try to apply surgery in different ways, in new situations, in ways that haven't been attempted before. We also are interested in applying new techniques. For example, there's a new technique called IRE, which is irreversible electrocorporation, as it turns out, and I won't try to explain what that is, but it's a way of treating the cancer with electromagnetic energy in a way that's different from before, and provides a new kind of what we call local therapy, in addition to surgery and radiation, for the treatment of pancreatic cancer. Another example would be using, in particular, immunotherapy, which is a theme throughout oncology and a very major theme in pancreatic cancer. We have two clinical trials right now that focus on immunotherapy in patients with pancreatic cancer, and hopefully more to come. We've been one of the large recruiting centers in the nation in these trials, and so we're trying to look beyond just surgery and drugs and radiation to even more novel ways of treating the cancer. We're very proud at VM of our association with the Pancreatic Cancer Action Network, which is the national patient advocacy group for pancreatic cancer. And something that we feel very strongly about at VM is listening to the voice of the patient. And in that regard, with respect to the network, they recently have launched a campaign based on their new slogan, which is Wage Hope. And I myself am currently serving as the National Physician Chairman for this organization. So in a sense, I'm the doctor for all 49,760 pancreas cancer patients across the U.S. And when people come to VM, I want them to feel that they're in a place that can offer them the very finest outcomes possible, both with respect to quality of life and quantity of life. We pay a large attention to supportive care. We're starting some unique programs. For example, thanks to a gift from the Hearst Foundation, we're one of 3 centers in the country that has a nutritionist specifically dedicated to pancreatic cancer. So we have our own nutrition to help with these challenges of weight loss and eating and diabetes, which are so critical to managing pancreas cancer. We're lucky that we've got tremendous colleagues throughout all the different areas that I mentioned, really people who are world-class and work together well as a unit. We also have a very active research program in which we have research protocols for literally every single phase of pancreas cancer, with a particular emphasis on testing new drugs. We're actually bringing 5 different new drugs for pancreas cancer to the clinic right now. And the hope is that by developing new agents and combining treatments in different ways, we can in fact achieve better outcomes. So all of this has been going on now progressively for over 20 years, and we're very proud of the fact that Virginia Mason really has some of the finest outcome data of anywhere in the world. It's really unsurpassed by any institution. So I can honestly say if you come to VM, you really can't find better outcomes anywhere that you might travel. Pursuant to this goal of waging hope, the Pancreatic Cancer Action Network has set down a challenge to the medical community here in the United States, and that is to double patient survival by the year 2020. And this is a challenge that they take very seriously. In fact, the whole organization is oriented around it. We at VM are proud of the fact that we just about have doubled survivorship already across all categories of people with pancreatic cancer, but we're anxious to do even better. And if we think about it, that leaves us just 5 short years to make the kind of transformational change in outcomes that we want. So we're very dedicated to that at VM.